This is an active range of motion for the elbow. The elbow flexes and extends in the sagittal plane and frontal axis, and it also pronates and supinates in the transverse plane and the longitudinal axis. So, patient has come in with elbow pain in her right elbow. So, can you point to where it hurts? On the medial side, okay. I'm going to take you through some active ranges of motion to assess the injury. So, using your good arm, you can flex the elbow so you touch your hand to your shoulder as far as you can. Is that okay? Yeah. Okay. Now to the affected elbow. Does that hurt?
Ow, yeah, that hurts.
Okay, so it hurts. And what would you rate that on the scale? What was 0 to 10?
5.
5. Okay. And what kind of pain was it?
That's a sharp pain.
Okay. And where is the pain? Along the medial side of the elbow. Okay. So now we're going to do extension. So with your good elbow, you're going to move your hand as far away from your elbow as possible. So all the way there. As far as you can go. Any pain? No? Okay. Now let's see with the bad elbow. Okay. Extension is limited. About 10%. And it hurts. Okay. So where does it hurt? Same medial side. And what's the pain scale?
5.
And how would you describe it?
Sharp.
Sharp pain. Okay, now we're going to go into pronation and supination. So with your hand straight out in front of you with your left hand. So we're going to start with pronation. So you're going to turn your hand as far as it can go until the back side of your hand is facing up. How's that? Okay, now with the second side. A little bit of pain?
Yeah.
Okay, and where's the pain? The same medial side, and how would you rate that?
Look at 2.
A 2, and how would you describe the pain?
Sharp.
Okay, so now with your good elbow, and range of motion is the same. So with your good elbow, you're gonna go palm up instead, and as far as you can go. Is that okay? Okay, so now the affected side. How's that? Yep, that's fine. Okay, and range is normal. Okay, now I'm going to use a goniometer to measure the amount of flexion and extension you have in your elbows. So I'm going to landmark on the lateral epicondyle. Here, you can see that. I hope you can see. Maybe just do it that way. Lateral epicondyle, and the stable arm is pointing towards the peroneum process. Okay, so we're actually going to take you into 180, so you can relax your arm. Okay, so this is resting. Okay, so now you're going to extend your elbow as far as you can, like you did before. And then using the styloid pulses. That's about 5 degrees. Okay, now move your arm all the way up to your shoulder as far as you can. And 50. So that's 120 degrees of flexion. Okay, so from my findings, I believe that my patient has a UCL sprain because of the pain in the end ranges during flexion and extension, but also the limitation in extension and a little bit of pain during pronation. Second indices could be a pronator teres strain, but we would typically see pain and limitation in pronation and also a little bit of flexion. The third indices could be a medial epicondylitis or epicondylosis, but we would normally see pain and limitation in pronation and supination.